Hello everybody, today we are talking about liver function test LFTs. LFT is panel of blood tests used to assess health and functionality of the liver. In this test, we measure the levels of the different enzymes, proteins and the substances produced or processed by the liver. So on the basis of measuring these enzymes, proteins, and substances, we can easily assess the health and functionality of the liver. If we talk about the components of the LFT, so there are a lot of components of the LFT. First one is the Alanine Aminotransferase, ALT, also known as SGPT. Next is the Aspartate Aminotransferase, AST, SGOT, Alkaline Phosphatase, ALP, Gamma-Glutamyl Transferase, GGT, total bilirubin, direct also known as conjugated bilirubin, indirect also known as unconjugated bilirubin, total proteins in which albumin, globulin, and the ratio of the albumin to globulin, prothrombin, PT or INR. Uh, Optional but not often included in the LFT. Lactate dehydrogenase LDH sometimes included in the LFT, not always. So these are the important components of the LFT. If we discuss detail of each parameter, first one is the ALT, alanine aminotransferase, or you can say SGPT. Function. ALT is basically an enzyme found mostly in the liver. It helps converts proteins into energy for the liver cells. So it's the function of the ALT. And normal range of this enzyme in the blood is 7 to 56 unit per liter. And clinical significance, elevated levels of the ALT in the blood show liver cell injury, for example, in case of hepatitis and cirrhosis. ALT is more specific to the liver than AST. So ALT is specific to the liver as compared to AST. AST can also raise in different conditions as well. But the ALT is most specific to the liver. Next parameter is the AST, aspartate aminotransferase, or you can say SGOT. Function found in the liver, heart, muscles, kidney, and brain. And AST helps metabolize amino acids. You have to notice that AST found in liver, heart, and muscles. So there are a lot of conditions we have to consider when we take in account the AST. Normal range of AST in our blood is the 10 to 40 unit per liter. Clinical significance increased in liver injury, but also in heart or muscles damage as well. So you have to consider all these things in your mind when you consider the AST in the LFT panel. So next is the AST to ALT ratio. That is the most important in the differentiation between the alcoholic and non-alcoholic liver disease. When the ratio is 2, then it suggests the alcoholic liver disease. And when the AST to ALT ratio is less than 1, it will suggest the viral hepatitis. So this is how AST to ALT ratio helps in differentiating the alcoholic to non-alcoholic liver disease. So you have to consider these aspects as well. Next is the alkaline phosphatase, ALP. This is the third one. Enzyme related to the bile ducts. That is the most important thing. And this enzyme also found in the bone, kidney, intestines, and the placenta. Normal range in the blood is 44 to 147 international unit per liter. Clinical significance elevated in biliary obstruction, cholestasis, and bone diseases. These are the different conditions in which you will see the raise in the alkaline phosphatase. And differentiation with GGT is helpful. We will consider in the next parameter, that is Gamma-Glutamyl Transferase GGT. GGT enzyme present in bile ducts plays a role in glutathione metabolism. Normal range is 9 to 48 unit per liter, and clinical significance, that is the most important thing, elevated in cholestasis and similar to the alkaline phosphatase. Alkaline phosphatase also raised in the cholestasis, and it is related to the alcoholic liver disease, that is the most specific one, GGT, and with drug induction. So elevated, whenever you see the GGT raise and ALP also raise, then it will suggest the biliary pathogenesis. And when you see the only isolated elevated GGT, then it go towards the alcohol or drug induced liver injury. So this is the most important. When the both GGT and ALP elevated, then it showed the biliary pathology. And when only the GGT is raised, then it go toward the alcohol or drug induced liver injury. So that is the important thing you have to consider. Next is the bilirubin function. Waste product from the breakdown of RBCs. This is how bilirubin produced in our body and processed by the liver and excreted in our bile. Total bilirubin's concentration 0.3 to 1.2 milligram per deciliter. Direct bilirubin, or you can say conjugated, 0.1 to 0.3 milligram per deciliter. And indirect or unconjugated, we actually subtract the total bilirubin minus direct bilirubin, then we will get the indirect bilirubin. Clinical significance, if you see the raise in the indirect bilirubin, or you can say unconjugated bilirubin, it shows the hemolysis and Gilbert syndrome. And if you see the raise in the direct, then it go towards the hepatitis and biliary obstruction. And elevated bilirubin suggests the jaundice as well. So this is in what in different conditions and how bilirubin raised in different conditions. Total proteins normal range 6 to 8.3 gram per deciliter includes albumin 3.5 to 5.5 gram per deciliter, globulin 2 to 3.5 gram per deciliter. And the ratio is normally greater than 1. Albumin to globulin ratio is greater than 1. Clinical significant less albumin shows the chronic liver disease, nephrotic syndrome, and malnutrition. AG ratio reversal means albumin is low and globulin high, then it will suggest cirrhosis and multiple myeloma. So this is the clinical significance of the proteins. Prothrombin time PT-INR international normalized ratio. Meyer's time it takes blood to clot depend on the liver produce clotting factor. If our liver is producing the normal clotting factors, then the clotting time will be normal. But if the liver is not producing the clotting factors properly, then the clotting factor will, or you can say clotting time will also be disturbed. So this is why we do the PT or INR in that condition. Clinical significance, grade PT means severe liver dysfunction. So this is one of the factor in increasing the PT time. Used to monitor this synthetic function of the liver. Next is the lactate dehydrogenase, if included. Enzyme found in many tissues and released during tissue breakdown. Elevated in liver disease, hemolysis, and myocardial infarction. There are a lot of conditions in which you will discuss the lactate dehydrogenase. And we often do not include LDH in the LFT parameter. LFT in diagnosis, interpretations by Patron. Patron hepatocellular injury. What will it indicate? Viral hepatitis and drugs and toxin. What test we will do? ALT, AST. These will be high in that condition, and ALT will be high as compared to the AST. This is the most important one because we are discussing the hepatocellular injury, and ALT is specifically related to the hepatitis, or you can say liver related. Next is the cholestatic injury, gallstones, tumors, bile duct issues. You will see the raise in the ALP, GGT, and the bilirubin. That is the important thing. Alkaline phosphatase and GGT. So first thing we will consider when both these enzymes are raised, we will consider the bile related issues. Next, synthetic dysfunction, cirrhosis, liver failure, low albumin, and the PT will be prolonged in that case. Hemolysis, hemolytic anemia, indirect bilirubin will be high, and LDH will also be high in that case. Methodologies used for the measuring of the ALT and AST, we use the UV kinetic and IFCC method. For the ALP, alkaline phosphatase, P and PP method or colorimetric method. For the measuring of the GGT, we use the kinetic method, bilirubin diazo method, Gendrasik graph method, albumin bromocresol green BCG or purple BCP method, total bilirubin biuret method, and PT coagulometer optical and mechanical detection. So we use the different methods for the detection of the different parameters of the LFT. Clinical uses of the LFT: diagnosing liver diseases like hepatitis, cirrhosis, and cholestasis, monitoring progression of the liver disease, and assessing drug-induced hepatotoxicity, and pre-operative screening. Before the operation, we got through the LFT. Monitoring alcohol use disorders, evaluating jaundice, and detecting metastasis to the liver. And next, causes of the abnormal LFT: elevated ALT, AST. In case of hepatitis, drug toxicity, alcoholic liver, and the fatty liver. Next, elevated ALP, cholestasis, bone disease, pregnancy, and the tumors. Bilirubin, hemolysis, hepatitis, bile, duct obstructions, and the genetic disorders. Low albumin, cirrhosis, and nephrotic syndrome, malnutrition, and protein losing enteropathy. So these are the different causes of the abnormal LFT parameters. Next, precautions during LFT sampling: fasting recommended, especially for bilirubin and GGT. Avoid hemolysis affects ALT and AST, because in hemolysis that will obviously disturb the ALT and the AST in that case. Use serum, not plasma. Avoid alcohol or drugs that may alter liver enzymes. So these are the precautions before taking the sample for the LFT. Mnemonics for remembering the LFT panels. So this is the quite amazing mnemonics that I have always keep in my mind. That is a bag of GG ball, A for ALT, B for bilirubin total, direct or indirect, A for AST, G for GGT, G for globulin, B for ALP, A for albumin, and L for LDH, and T for total. But in that case, B can also, you can remember it in the sequence: a bag of GG BALT, BALT. So this is all about the liver function test. If you still have any question or have any confusion, you may ask in the comment section. Thank you so much.